Hi, my name is Amit Hussain. I'm a neurosurgeon at Loma Linda University. I perform minimally invasive spine and neurosurgical procedures. I was trained at Johns Hopkins University and Swedish Medical Center along with Penn State University. So the sacroiliac joint is an important joint in our body. It joins the sacrum, the area of the spine at the bottom, below the lumbar spine, to the pelvis, which is right next to that. There's a lot of reasons for SI joint pain. It could be due to previous life experience like childbirth or traumas or falls or car accidents. It could be due to previous procedures that you had. Spinal fusion procedures oftentimes can make the spine more rigid, and that leads to more stress on the SI joint, which is next to it, and that can cause SI joint pain.
I'm Joy Phelps, and I had this surgery August 2nd. The level of pain was just off and on level 8 pain with just barely moving. It was just severe pain. That really damages your life. When you're in pain, your whole attitude, for example, I play guitar. You lose your desire to stand up, play guitar, or sit down and play guitar. You don't want to do nothing when you're in pain. You're not the same person at all.
My name is Tim Verhelli, and I'm 72 years old, live in Redlands. I play golf now, and it got so bad that, halfway through a round, people I was playing with were asking me, do you really want to finish? Because I looked like I was severely in pain. Wouldn't be able to stand up straight when I got done, but I don't know, I kept going. But
when I see patients with sacroiliitis, they usually complain of pain in the low back, a little bit off midline, and that sometimes radiates to the buttock and down the leg. Sometimes people complain of hip pain and groin pain as well, and these are all factors that clue the physician into, hey, this might be an SI joint problem.
I had a previous surgery for sciatica, and Dr. Hussain did such a good job with that maybe he could fix this. So I had my family physician refer me again, and he had me explain in detail where the pain started from, what it did, and then had me go to the pain clinic for a series of 3 shots a couple weeks apart as a diagnostic tool. And the shots would help for a day or two, then they would wear off and I'd be back where I started from. But that's what he wanted to hear.
There's a broad differential diagnosis to low back pain and SI joint pain, which is why it's really important to see the right practitioner for this disease process. I start off my evaluation with a thorough history and physical, making sure that we cover all the history, the previous surgeries that you've had. We examine several aspects of the patient's spine, including the Fortin finger test, which is just an examination to show where the pain is located. Then we do a set of 5 provocative maneuvers where we move the pelvis and the sacrum to put some tension on that joint. And if that reproduces pain, then that's most likely the cause of your pain. At that point, we'll send you to a pain management doctor often to get a diagnostic SI joint injection. This injection is just an outpatient procedure where they insert a needle into the joint and they inject pain medicines to see if that'll help. If that injection helps with your pain, a lot of times we can prescribe belt therapy, physical therapy, injections, but a lot of times these can be temporary. If they're temporary but they're long-lasting, then we continue that therapy long-term. However, some patients are dissatisfied by the temporary nature of these fixes, and oftentimes they elect to get a permanent solution, which is the surgical approach. The procedure is minimally invasive. You come in for surgery. The surgery is less than 1 hour, and you go home the same day. We make a small incision on the skin, and then we dilate down onto the bone. We use x-rays and navigation system to localize where we're gonna put a set of pins into the joint. And the pins, they're a small titanium triangular implant, and it's done through a very small incision. Once these pins are fixated into the bone, it causes pain relief due to lack of motion of this joint.
I remember having a tough time walking, but once I could walk, I can't explain it. It was like getting my life back. There was no pain, and it was like a miracle that pain was gone.
After that first day home, it was fine. I just used a little bit of a walking stick to go up and down stairs, keep the weight off it, but it was fine. Within a couple weeks, I was moving around pretty much normal. I started golfing probably a little sooner than I was told to.
I'm now playing guitar 2 or 3 times a day. singing my heart out because I feel so great about life now. I didn't want to play my guitar before. Now I'm happy. And I walk, I'm constantly on my feet. I'm hardly ever sitting down during the day. I'm moving back and forth constantly, walking here and there. I'm getting back who I was.
When you're looking at SI joint pain, it's important to see a physician with a lot of experience. To be evaluated for the fuse procedure and to get an evaluation with me, please give our officer a call.